Oh, good afternoon, everybody. Before I get to the numbers, I want to address the federal stimulus bill that was passed in both the Senate and House and is anticipated to be signed soon by President Trump. For the better part of a year, governors, myself included, have called for Democrats and Republicans in Washington to put aside their political differences and pass another stimulus package to give states the support and flexibility needed to protect our citizens and our small businesses. I was relieved to see funding for our small businesses, for vaccine distribution, for an extension of unemployment benefits, and an extension on the amount of time we have to spend the CARES money that we got months ago. However, the final package doesn't include funding for state or local governments to support critical services. And without that funding, we risk having to make further budget cuts that could threaten our recovery. While I'm grateful for what is in the relief funding bill, I would encourage the Kansas congressional delegation to continue to push for additional funding for states and cities so they can beat back the virus and shore up their economies. Next, for our Public Health Hero Recognition Series, I want to recognize the efforts of Dr. Alan Greiner. He's the Chief Medical Officer for the Wyandotte County Unified Government Health Department. Wyandotte County, the entire Kansas City metro area, has been among the hardest hit by COVID-19 in our state. Dr. Greiner has been involved in ensuring that residents and businesses have accurate, up-to-date information on best practices for virus mitigation. He has remained flexible, assisting the unified government in implementing new health orders as needed, as case rates and public health guidance fluctuates. Wyandotte County and the state as a whole owe Dr. Greiner a debt of gratitude for his hard work. Dr. Greiner, if you're watching, thank you. Now for the COVID-19 numbers update. As of Monday, Kansas has reported 4,174 new positive COVID cases and 107 new deaths since last Friday. This brings us to a total of 204,600 cases, 6,267 hospitalizations, and 2,448 deaths. Vaccine distribution will be a months-long process, and it is more critical than ever that we continue to listen to the public health experts. That means, again, wearing a mask, avoiding mass gatherings, and physically distancing. I know it can sometimes be difficult to see how our individual actions make a difference within the context of an entire state, but they do. And today, I can share some good news with you. Based on the effective reproduction rate, that's the R0, we know the successful implementation of the unified testing strategy has led to the control of the spread of the virus in Kansas for the first time since the stay-at-home order was lifted in May. There is no doubt that this change is also a result of additional counties opting into my administration's face covering protocol. The evidence is clear. Wearing a mask is an effective strategy to mitigate COVID-19 in our communities and an essential element of my all-of-the-above strategy to protect Kansans. So I would repeat, if each of us takes personal responsibility and follows the guidance of public health experts, we can continue to slow the spread of the virus. Now for a vaccine update. As a reminder, the vaccines are going first to high-risk healthcare workers and long-term care facility residents and staff. Late last Friday evening, the Food and Drug Administration announced the second COVID-19 vaccine, Moderna, received emergency use authorization. We started to receive the Moderna vaccine early this week. We anticipate receiving 49,000 doses by the end of the week. These doses are being distributed through local health departments and federally qualified health centers across the state. As for the Pfizer vaccine, we anticipate a little over 17,500 doses in the second shipment to arrive sometime this week. These vaccines will go to CVS and Walgreens, who will be administering the vaccine at long-term care facilities as part of the National Pharmacy Partnership. Additional vaccines are expected next week, with approximately another 17,500 from Pfizer and 20,000 from Moderna The Pfizer allocation will continue to be used for long-term care facilities, and Moderna will be used for healthcare workers. The National Pharmacy Partnership is a federal program that partnered with CVS, Walgreens, and Managed Healthcare Associates. This program is charged with administering the vaccine to long-term care facilities at no cost to the facility. This program will help reduce the burden on our long-term care facilities and our health departments. I'd like to end today with an update on our unified testing strategy. As of yesterday, the state has performed 132,000 tests directly related to the unified testing strategy. Since the beginning of the pandemic, there have been a total of 946,000 tests administered. The number of free testing sites available on gogettested.com/Kansas is now up to 36, and will continue to add more testing sites on a weekly basis. I encourage all Kansans to take advantage of the free testing opportunities at this site. As I've said before, this type of widespread screening is key to catching asymptomatic carriers and stopping the spread of the virus early. Now, I want to turn it over to Dr. Lee Norman, Secretary of Kansas Department of Health and Environment, to provide some information and guidance for Kansans heading into the Christmas holiday.
Thank you, Governor. With the holidays now just days away, I want to touch on the low-risk activities that the CDC has recommended for you and your communities to consider. Having small dinners rather than large meals with the people who live in your same household. Preparing traditional family recipes for families and neighbors, especially those at higher risk for severe illness for COVID-19, and delivering them in a way that does not involve contact to others. Having a virtual dinner and sharing recipes with families and friends. We need to know that our vigilance is important over the holidays to help protect those that we love. And I think it's important, the governor touched base on it, that we didn't see the marked surge that we had worried about after the Thanksgiving holidays. So I commend the people that took that great advice to heart. As she pointed out, that the infectivity factor, the reproductive factor of the virus is improving. And it's the personal responsibility and activities that people have done along with the measures that the governor took, and I think people should be credited for that. And now I'll turn it back to Governor Kelly for questions.
Governor Kelly, you used a phrase about the unified testing strategy getting us under control. We're still seeing an excess of an average of 2,000 cases a day. That's down significantly from a peak, but I guess someone who's skeptical could question how 2,000 cases a day is under control.
Well, you know, I'm going to turn this back over to Dr. Norman, because what we talked about in the comments was the R0, that reproduction rate, and that is down. And I think it's important for people to understand how significant that metric is.
Yeah, that's a good question, John. The infectivity factor or the reproductive factor, if it's 1 or lower, it'll eventually burn out and will go away as a pandemic in this case. If it's greater than 1, it will continue to spread and gain in terms of the total numbers. We're only at 0.97, so that comes out of the Johns Hopkins database, which looks at databases all over the country. The more important is that the trend line has been gradually going down. So yes, you can still have hotbeds over here, for example, that'll have an R sub naught of 2 or 3, meaning that every one person that gets it, they'll spread it to 2 or 3. But the overall trend line as a state is dropping down to just slightly below 1.
I did have a question about the vaccine. A question came up. What is the state doing to verify that people getting the vaccine are the people who should be getting the vaccine? In other words, you're making sure that at a hospital, it's going to the people who are at risk as opposed to, you know, the administrator.
Well, I think,
or the CEO or something like that.
so how are we determining that the people who are getting vaccinated are
Right.
the ones who are supposed to be in the queue for vaccinations. You know, I think right now it's pretty easy because very limited number of folks or categories of people are eligible, and that is your frontline healthcare workers in your hospitals, in your nursing facilities, in the prisons. So that control group is pretty easy that group is pretty easy to control. You know, where we will fall back on the honor system that was talked about last week is when we move it out to more of the general public. And you know, I believe, as Dr. Norman believes, that Kansans are an honest group of folks, and while they might not like it, if they're not in the queue at a certain time, I think that they will wait their turn. And we'll make it very clear as time goes on and vaccines are coming in, and we're moving past this first phase, which is so clearly just healthcare workers and long-term care facilities. We'll have a pretty clear understanding of who's next in line.
Governor, we continue to get tons of complaints about KDOL and unemployment to our newsroom. Yesterday, the site was down. We got with the phone lines, site generally, late payments. Do you have any comment about that?
Yeah, we continue to get, in many ways, anecdotal responses to the situation over at the Department of Labor. You know, but I can tell you that you know, things are not as bad as the anecdotal information presents to you. You know, the folks over at KDOL have processed 3.2 million claims since March. That's an incredible number, incredible amount of work to have done. The wait list, the backlog, has gone from 25,000 down to about 1,800 today. So clearly, you know, there's a lot of work going on there, and a lot of effort being made, and progress, tremendous progress has been made. Are there problems still? Yes. Will there be problems tomorrow? Yes. But it's how we approach problem solving that's most important, and we've approached it pretty aggressively, and I think been able to resolve most of the problems. Obviously, not all of them.
Governor, do you still have?
John, what is it?
Why did they chose to appoint another acting secretary today rather than a permanent nominee after 6 months?
Well, the way the acting works in statute, you can appoint somebody to be acting for 6 months. So the deadline for the 6 months was today, December 22nd. All right. So you know, we are in the process of seeking a permanent Secretary of Labor, and until we have that person in place, we will continue to have an acting. We hope to be able to take care of this pretty soon. We've been working hard and looking far and wide, and we think we'll be coming to some resolution in the next couple of weeks.
Governor Kelly, you know, with the extension of the CARES Act spending deadline, how does that affect the state's timeline in terms of the CRF that has been already given out?
Yeah, what you're talking about is you know, December 30th is no longer the deadline for absolutely every dollar of the CARES Act money to have been spent. That's incredibly helpful, and probably will be most useful for us in terms of our testing, you know, because we put a whole lot of money into the testing program, and we were going to have a very hard time. In fact, it was going to be impossible to spend it on the testing in that length of time. So now that we have this extension, you know, we will be able to use that money more appropriately and more effectively because of that. You know, Kansas actually probably one of the states that push money out quickly and broadly, and we have actually allocated every nickel of the CARES Act money already. What this extension will do is, you know, we were going to be, you know, bringing the money back from counties who had not been able to spend it by December 30th. We were going to bring that back and reallocate it in places that it could be spent. Now we won't have to do that. You know, they will have an extended period of time to spend their funds, which I think will be very helpful for our counties and our cities.
Coming back to vaccine rollout real quickly, where do inmates kind of fall in that pecking order? Have you had that conversation?
Yeah, well, when we start doing congregate settings, you know, you'll be looking at the correctional facilities because those are congregate settings, just like our state hospitals are congregate settings. So when we get to that point, the correctional facilities will be included.
Does the definition of teachers, which is kind of that spring-ish, does that include college professors?
Right now, it does not. You know, and part of that, the thinking is that most colleges right now are operating remotely, and so there's no congregation of folks all in one place, and so the need to move them higher on the list is not there, unlike, you know, being able to bring a class of third graders back into the school.
Dr. I have a couple of questions. The White House report shows Kansas has the 10th worst case rate in the country and 4th highest positivity rate. Why do you think that is at this point? What needs to change?
I'm sorry, I really couldn't understand that.
Oh, sorry. A White House report shows Kansas has the 10th worst case rate in the country and the 4th highest positivity rate. And why do you think that is at this point? What needs to change?
Well, I'd be interested to know when those numbers came out, but you know, what we're doing is looking at, as Dr. Norman was talking about, looking at the trends, and they really are starting to go down. We expected a big surge after Thanksgiving. It didn't happen, you know, and I think, you know, Dr. Norman thanked the people of Kansas, and I will too, for having done all the right things, for wearing their masks, for not gathering, and for distancing. But also give credit to the unified testing strategy, which has really exploded the number of tests that we are doing. So, you know, sure, we want those numbers to continue to come down, and we want to continue to protect Kansans and be able to reopen our economy. And every measure that we're taking is moving us in that direction.
Thank you.